Okay, so as we mentioned, we shall just give it a moment for the attendees to enter the room. Maybe give it 30 seconds, 45 seconds, something like that. So just bear with us while we let everybody enter the session. Okay, we have people coming on in. So we can do some introductions and get the webinar started just while everyone's coming in and taking their virtual seats, I guess. So hi, everybody, and welcome to today's webinar where we're going to be talking about building trust in pain research, which I think is a really interesting topic. And we have some fantastic panel members today who are involved in introducing a framework aimed at making pain research more trustworthy. Perhaps I can give a little bit of an introduction. I don't want to take too much away from our amazing speakers from today, but as a kind of basic and brief introduction, the ENTRUST-PE initiative, which I'm very happy to announce is endorsed by EFIC itself. So we're really happy to kind of announce that. Obviously, more information will be released in due course. This initiative not only benefits researchers and healthcare professionals, but also serves patients and the public by promoting more effective and transparent pain management research and strategies. I kind of stick that there. I don't want to dive too much into it because Neil has got a fantastic presentation, but enough from me kind of about that. I'm going to let our speakers obviously tell you a bit more in a moment in the main section of this webinar. So a little bit more information about the webinar itself. As always, they're designed to be interactive, so we encourage you to take full advantage of the opportunity to engage with the speakers who are authors on the paper. You can submit your questions at any time through the chat or the question and answer module, which should be at the bottom of your screen. You can engage in that in anonymously as well, so please feel free to get your questions in there, and we'll pose those to the speakers when it comes to after the presentation during our discussions. Each of our guests will have a chance to kind of answer those. So you might be able to see on your screen, joining me today is Neil O'Connell, Andrew Rice, and Anna Hood, who will be able to answer our questions about this project and obviously share exactly what the project involves. So I'd love to go into some introductions and to get you familiar with our panelists. So Neil, good afternoon. Thank you so much for joining us. Would you like to give us a brief kind of introduction to yourself?
Thanks, Nathan. Hi, everyone. I'm Neil O'Connell. I'm a professor of evidence-based healthcare at Brunel University, London. I'm a physio by background. A lot of my work is around evidence synthesis with regards to the effectiveness and safety of interventions for pain. And I was a scientific coordinator of the ENTRUST-PE network and the resulting framework. And that was funded by the ERA Net Neuron Co-Fund. But lovely to be here today. Thank you.
Great to see you. Thank you so much for taking time. I appreciate it. And of course, the same goes to Andrew. Welcome in. Good afternoon. Thank you so much for joining us. Would you like to give us an introduction to yourself?
Thank you, Nathan. It's a pleasure to be here. I'm Andrew Rice, Professor of Pain Research at Imperial College London, and I'm also currently the President of ISP. I had the privilege of being one of the many authors of this document, and it's very exciting for me to also report that ISP have also formally endorsed ENTRUST-PE. So as you can see, it's getting traction across the ISP family of organizations. If one of the important things about being endorsed by both ISP and EFIC is that it gives chapters the opportunity to translate aspects of this into their own languages, and we'd be interested to hear from chapters and chapter members if they wish to do that. Thank you.
Absolutely, incredibly important. I think that's a real significant factor on the importance of this topic and it being endorsed by those organizations. And we'll talk a little bit about the importance of translations and adoption within the chapters more a little bit later, I guess. Finally, obviously, last but not least by any stretch, Anna, thank you so much for joining us. Feel free to give yourself or give our listeners a bit of an introduction to yourself. Welcome in.
Thank you. Thank you so much for that and a pleasure to be here. I'm Anna Hood. I am a lecturer in psychology at the University of Manchester, a clinical psychologist by training. Most of my work sits in pediatric pain, working with children and young people, with a particular focus on children and young people living with sickle cell. And I was happy to be a part of the framework and an author on this paper.
Brilliant, fantastic. So, as you can tell, guys, we have some very, very key people here who can discuss this topic and give us some insights into the framework, which is going to be really interesting. As a reminder, again, I like to give these reminders as often as possible because it's easy to forget and it's easy to get lost in the content. But again, this is an interactive webinar, so feel free to use the chat or Q&A function. Again, is at the bottom of your screen, and you can ask questions anonymously, which I tend to do quite a lot when I'm in other webinars. So feel free to take advantage of that one. So, okay. Shall we get into the content itself? So Neil, you have a presentation for us. Are you okay to continue and take it from here? And we'll find more about the framework.
Perfect. Thank you, Nathan. So I'm going to give a short sort of 15-minute summary of the framework, why we need it, what it looks like, and what it might mean for practice before we get into a panel discussion. I should just start with my declaration of interest. As I said, I draw my salary from Brunel University, London. I'm a senior editor for the Cochrane collaboration. I'm the chair of IAS Methodology, Evidence Synthesis and Implementation Special Interest Group. And I was the PI receiving funding from ERANET Neuron to run this project. So they're just my declarations. And I want to start with good news, because when we talk about research quality, trustworthiness, we can start getting into some thorny and sometimes quite confronting issues. So I want to start with some good news, and that is, obviously, in pain, there are fantastic examples of rigorous, well-reported, equitable, groundbreaking work. And we should all celebrate that. And when we go to conferences and we read our journals, we can all see good examples of that. But any mature sort of scientific community also needs to be prepared to do a bit of self-reflection and a bit of critical self-reflection and look at whether the situation that we have is genuinely as good as it might be and is genuinely serving all people with pain and delivering high quality and trustworthy information. And when we talk about trustworthiness, it's important probably just to parameterize what we might mean by that. I took Professor Google's definition of trustworthiness when we started this project, which is the ability to be relied on as honest or truthful. And in the research and the clinical community, we often hold research up as a more trustworthy, more reliable source of information. And partly because research is this process of applying process and structure to observation. And it's that methodology, that application of process and structure that allows us to be more confident in the veracity of the information that it produces. So let's use that definition, the ability to be relied on as honest or truthful. I quite like this example Google gave. Now, forgive the gendered example here. This is taken directly from Google, but the example they gave was, he has to prove his trustworthiness to you. They have to prove their trustworthiness to you. And I thought that was really telling, because there's something about a burden of proof here. Whose responsibility is it to demonstrate that research and information based on research is trustworthy? Now, as an evidence synthesist and working for Cochrane, we do large systematic reviews of bodies of literature. And when we think about trustworthiness, or when we've thought about it historically, we've often thought about it in the context of risk of bias. Sometimes we call that study quality. But when we consider the criteria that we use to evaluate study quality, they're nearly always a reflection of methodological rigor and transparency in reporting around those methods. And arguably, that is just one piece of the puzzle about what makes research more trustworthy. Now, methodological rigor and transparency around methods are obviously absolutely critical. But let's think about some other ways in which process might undermine the trustworthiness of our research. Before we get into specific examples, I have this quote from Doug Altman, Professor Doug Altman from the University of Oxford, who sadly died a few years ago. But he wrote this paper all the way back in 1994, a very confronting, challenging commentary called The Scandal of Poor Medical Research. And I just take this quote because I think it's really powerful. What should we think about researchers who use the wrong techniques, use the right techniques wrongly, misinterpret their results, report their results selectively, cite the literature selectively, and draw unjustified conclusions? We should be appalled, and yet numerous studies have shown that all of the above phenomena are common, and this is surely a scandal. And this comment at the end in red: we need less research, better research, and research done for the right reasons. So beyond methodological rigor, let's look at some of those examples of where things might fall down. Some of you may be familiar with the term questionable research practices, questionable research behaviors. These are things that are not specifically about how you design a study in good faith. They are genuinely conscious, possibly sometimes unconscious, decisions that researchers can make in order to make the results match their preconceived view, opinion, their desired result. So within there, we'd have things like p-hacking, that sort of idea that if you torture your data long enough, you can get it to confess to anything, or hypothesizing after the results are known, or selectively only presenting analyses that give a certain answer. There are lots of different types of questionable research practices, and meta-science tells us that they're common in the health literature broadly, and we also see them be relatively common in the pain science literature. There's also this question about trustworthy to who. Who should trust our research, and who do we want to trust our research? I would like to think that I wouldn't be going out on the limb to say that most, or hopefully all of us, believe that we're in the business of generating knowledge that can improve the lives of everyone globally who may have pain. And yet we know, again, this is true of health research and pain research, that we generally fail to create research that is genuinely equitable. We can see this in the fact that many research studies will systematically exclude people from particular ethnic backgrounds or racialized groups. We can see that in the underrepresentation of women in studies of conditions that equally affect women and men. We can see it in the underrepresentation of elderly people, of entire global regions in our research, and even in preclinical research, the tendency to focus on young male adolescent rats of a very specific genetic lineage really restricts the kind of generalizability and the inclusivity of research. But that equity piece isn't just about who we include as participants in our research. It's about who gets to be part of our research community, who gets to enjoy a research career and lead in a research career, who decides on the questions we ask, about whom, for whom, and how do we communicate that research and the results of that research so that they can genuinely benefit everyone. And then there's the aspect of, if you think about most research papers that you pick up, how much information do you actually have in order to be confident in what was done, how it was done, and what was found? We're often in research papers left with summaries, and those summaries can be quite partial in terms of the information that they present. We might see entire outcomes that were planned in a study not reported. We might not be able to clearly see the full methodological process. We might not be able to see the data, the analysis code. We might not even be able to see the plan if studies weren't pre-registered. And so we need to sort of address that. And of course, open science is one mechanism for that, but we'll come back to solutions later. There are lots of potential threats to research integrity, everything from unethical practice or incomplete ethical approval to undisclosed conflicts of interest, to poor data stewardship, to just generally poor governance. And we don't generally have mechanisms for scrutinizing those in any great depth, but we know that they're there. And we know from broader health meta-science literature that things like undisclosed conflicts of interest and other ethical breaches are not uncommon. Then there's the issue of how we communicate our research. So as scientists, we, at least particularly in quantitative research, we like to believe or aspire to a sense of blind objectivity, the sense that we are controlling those natural human biases and we are being objective and transparent. But what we see in a lot of scientific reporting is the presence of spin, of slightly unbalanced communication in order to drive a specific message. And that might represent itself as selective outcome reporting. It might represent itself as under sort of recognition of the limitations or uncertainties in a study, or simply overselling and overgeneralizing the results of the study. And then the really dark end of these threats is research misconduct. And it's something that we don't talk about a lot because it's difficult to talk about. But by research misconduct, what we're really alluding to is the fabrication, the falsification, the manipulation of results in order to create a certain outcome for a study. Now, we might think that's uncommon and that fraudulent or fabricated research isn't common. What we're actually seeing across the whole discipline of health research is where we look for fraud, we can find fraud and misconduct. And I thought this survey from Daniel Fanelli, it's actually a review of surveys of scientists asking about how many of them have personally engaged in questionable research practices and how many have engaged in falsification, fabrication, and modification. And you can see that about a third of scientists, when asked about themselves, will say that they may have done a bit of p-hacking or, committed some of these questionable research practices. But only 2% will admit to have ever falsifying, fabricated, or modified data. But it gets interesting when you ask them about their colleagues. So if we ask scientists if they've observed these behaviors in their colleagues and their research community, they will say 72% will say that they've observed questionable research practices in their colleagues, and 14% will say that they have personally engaged, they've seen their colleagues engage in falsification, fabrication, and modification. Now, this is almost certainly an underestimate of the truth situation because of the social pressure biases that are inherent in answering a survey like this. And I think we should be confronted by it and think carefully about what that might mean. All of these things create plastic in our ocean. They create noise that makes it harder for us to spot that great research that we were talking about in the first place, but also it creates an awful lot of potential for misdirection, blind alleys, and not moving towards a better understanding of pain and better ways of managing it for everyone. And I'll choose another confronting quote for my presentation. This is from Richard Smith, the past editor of the BMJ, back in 2021. And I don't necessarily subscribe fully to this, but I think it's a really important quote. And that is, it may be time to move from assuming that research has been honestly conducted and reporting to assuming it to be untrustworthy until there is some evidence to the contrary. And what I'd like to propose with the ENTRUST-PE framework is that if we were to follow that framework, we could just remove assumption from the process, and that would be healthier than the situation that is being suggested on this slide. So now just to talk about ENTRUST itself. We were funded a small networking grant that ran over a year in 2023, and our mission was to develop a novel integrated framework for enhancing and facilitating the trustworthiness of evidence in pain. I just want to show you the network. We had a fantastic group of academics, of senior editors, of people across preclinical and clinical disciplines. We had patient representation. We had early career researchers, including a PhD student on there. And we had a sort of situation where everyone was offered an equal voice. It wasn't hierarchically driven in order to come up with our framework. And the way that we ran this was that we met 7 times over the year, including a 2-day face-to-face meeting here at Brunel University in West London. And we went across identifying what are the core elements of trustworthy research, what are the challenges to that, and what are some potential solutions and recommendations. And you can read all about that in our white paper, which is freely available on our website, and I'll show you a link to the website later. But I just want to summarize the framework before we get into a panel discussion. So we visualize that research, trustworthy research, is underpinned by a set of core values. And we use the word values advisedly because it's about, what is it we value about this process? Why do we do research? What is it for? And the core values start with integrity and governance, that research should be conducted in a spirit of integrity and honesty, and we should adhere to and be aware of modern contemporary standards of best practice and governance in our research. That encompasses everything. And then within that, we have the following core values: equity, diversity, and inclusivity. So coming back to the point I made on the earlier slide, that we think that trustworthy research is created within cultures and communities that are equitable, diverse, and inclusive, that research strives to be equitable, diverse, and inclusive in who it includes within the research, who the research is done with, and that should also be embodied in how research is disseminated, shared, and communicated. The next core value is patient and public involvement and engagement. And I'm sure I'm surprising no one in the room that we have PPIE in here as a core value. But it was the view of the network that PPIE is absolutely essential for us to move to a position where we're asking questions for people, the questions that are important to people with pain. And we're working out how to best frame and answer those questions with those people. And we're communicating those results with those people. And not just a consultancy, but embedding meaningful PPIE throughout the process of research. The next one, methodological rigor. It had to be in there, of course. It's traditionally how we understand sort of trustworthiness of research, but we need to focus and obsess about our methods and be sure that we're transparent and precise about our methods, because it's those methods that underpin the results that we will then be promoting to the community. The next value is openness and transparency. And by this, we mean across the entire research process. And that will mean engagement with pre-registration. It will mean the publication or public availability of detailed protocols. And as far as is possible, it will be the sharing of materials, of code, of data in as public a way as possible. There's a great line from the British Psychological Society's policy on open science, which is as open as possible and only as closed as necessary. And we believe that is a great spirit in which we should be approaching openness and transparency. The next core value is balanced communication, the idea that as researchers, we should strive to minimize bias in how we communicate our research, really recognize uncertainty, not be selective, and focus very sort of in a balanced way on the totality of the results. And the last one is data authenticity, that we need to be alive to fake data, fraudulent data, erroneous data. And we need to have mechanisms for identifying it and removing it from the literature in a speedy, fair, and transparent way. But we also recognize that this isn't really just about researchers, that we work within a complex ecosystem that incentivizes both good or bad practices. If you think about publish or perish and the things that build academic success and careers, they can actually perversely encourage bad behavior towards rigor, for example. So we recognize that researchers work and are surrounded by peers, leaders, and mentors, and that local culture and behavior will influence what they do and how they behave and what they think is normal, that the institutions in which they work will have their own policies and levers that will either encourage or discourage good practice. Funders, regulators, and policymakers all have power in requiring good governance or encouraging bad practice. Peer reviewers, so that's all of us, isn't it? Editors and publishers have a key role as gatekeepers to science making it into the public domain. Consumers of research potentially have a role, and people with pain, of course, as well. And that actually, if we really want to improve the picture, then the whole ecosystem needs to come with us. We need to work as a community. This isn't all about the individual researcher on the ground. So if you look at our visualization of the whole framework, you can see the core values I just described represented there. But this recognition that they sit, those values drive required actions and behaviors that will help improve trustworthiness. But that will depend on the entire ecosystem making changes in order to drive and facilitate and incentivize those good practices. I show you this, it probably looks a bit small on your screen, but this is just one of the infographics and tools that we created to try and help researchers to engage with the framework. And what I'm hoping you can see here is that we take the life cycle of a research project from inception to publication, and you can see that at each stage we try and give recommendations for how each of the core values might be brought to bear on that research project. And we also show the different role of editors, publishers, peer reviewers, researchers, peers, mentors, leaders, and of course institutions, funders, and policymakers. In terms of materials that we've made publicly available on our website, we have a detailed white paper. It's a meaty document, but for those of you who have trouble sleeping or like a long read, I can't recommend it highly enough to you. But we've also created a short executive summary and then specific summaries for different stakeholders in this process, each summarizing the recommendations that we make for that stakeholder for each of the core values of the process. So we're hoping that makes it much more accessible to people. These are quite short, sort of 3-page documents, quite punchy. And as I said, we have a website. It's got a nice explainer video on the landing page. It's also got linked to a whole range of external resources, external to our project, that people can then use to improve their ability to, say, embed ED&I into their project, or PPIE, across all of the values we've curated, collected, and put links to resources to help people. Nathan, you touched on this at the start, and I'm about to finish, but just to say, we are absolutely delighted that, having only really launched the project at the end of December last year, that we've received formal endorsement from IASP and EFIC. I think this is such a fantastic thing. Remember, this whole project is about helping the community to move towards just more robust practices across the piece. And I think what we've tried to create is a really can-do set of products to help people do that. And to have this endorsement is potentially, I think, very powerful. So let me just sum up that, trustworthiness of research is actually quite multidimensional. Much of what makes evidence trustworthy has traditionally been either just assumed or taken as some sort of act of faith. And that is probably quite naive. Our framework offers a framework to guide practice and reporting to enhance the trustworthiness of research for everyone. But, to achieve meaningful change requires both systems level change, but also community level action from each of us. And I'm going to stop there. Many thanks for listening. And I think then I'll hand back over to you, Nathan, to lead the panel discussion.
Yeah, fantastic. Thank you so much, Neil. Lots of detail, and at the same time, not enough detail to cover everything that's been going on, because it's such an expansive project. So if anybody has access to the resources, Melinda has just put the link to the website in the chat. Please feel free to have a look at that, because there's lots of other resources on there as well. I'd like to pass it to Andrew initially to add anything to what Neil has obviously explained there.
No, I mean, Neil has given a great overview of what is a very complex topic. I mean, I guess the one reservation I have about this is that it's very easy for someone like me, who's frankly at the rear end of his career, to pontificate about these issues. But the real stakeholders here are early career researchers. And one of the problems I think we have in implementing this is that the reward systems for promotion, for getting grants, et cetera, are really based on concepts around what you might call novelty, which is often not replicated. And rigor and all the things that Neil has been talking about are not generally rewarded at the moment in things like promotion and grant submissions. And therefore, I think at the nub of this is the need for a culture change in how we assess research. And to me, it's about asking an important question with methodological rigor and reporting it openly, and changing the balance so universities and other bodies promote on the basis of that. But I don't, Anna and Neil and Nira are less far from the end of their career than I am, and I'd like to know your perspectives, and particularly if there's any ECRs on the call, because what we can't do is compromise them and their prospects.
Yeah, I think it's a great point. And again, anybody who is watching, myself, an early career researcher, those are the concerns that we do have in our mind. So if anyone who is watching this webinar, please feel free to comment or pass on your thoughts about sort of the pressures that Andrew's mentioned there, and your considerations about how important it is to, the role that the ENTRUST framework can play in that, and how you might decide to adopt that, given the longevity that remains in your career is significant, right? Anna, welcome. Thank you. Any thoughts on what Andrew was mentioning there? He did mention that obviously you have some career left, of course. Has that ever kind of passed your mind? Probably. We'll see how this webinar goes, of course. Do you have any thoughts about what he's mentioned there, and any concerns? And do you think that resonates with a lot of early career researchers?
Yeah, I think it does. I think there's the challenge to, publish as much as you can, get work out quickly, that it doesn't always align with our framework, doesn't align with ENTRUST-PE. And how do you balance that with doing, research that includes all the people that it should, engages patient and public involvement, and is, has rigor in its methodology. And I think it's a balance. I think right now, depending on where you are in the world, there's more or less support for that. I know there are institutions, I think mine included, and maybe Andrew's and Neil's as well, that is, there is funding now for open science. There are open science early career fellowships, both in quantitative and qualitative work. I actually saw at my institution just recently. So there is that, I think, acknowledgement that this is something that we need to move towards, and how do we do it? But yes, there's definitely still barriers to do that, and I think we need to increase the number of facilitators so that people can adopt. I saw a question in the chat, so I'll stop there, but I think there's some other things that we could talk about as well.
Absolutely. And I think it's a really interesting point, and we'll obviously get to the questions that are in the chat. Thank you so much. Please add some more questions if you do have them, or if they're just general comments, they can go in the chat, and obviously the questions can be asked anonymously as well. So Andrew kind of brought to the forefront there one of the challenges of this project, and kind of tailored it specifically to early career researchers. Maybe we bring it back to Neil just briefly. What are the most significant barriers when we're considering this type of framework and implementing it in, as you mentioned, not at an individual level, but at a systemic level as well, which is such a big ask? What do you see as the main, alongside what Andrew's mentioned, the main barriers to ensuring trust in pain research, and how can researchers and clinicians overcome those?
Yeah, I mean, first of all, when we were talking about trust in pain research, I just want to give it, when we went into this process, we that was our mission. It remains our mission, but what we've actually ended up with a framework is a framework that's relevant for all health research. There's very little actually about this that is specific to pain. So just to bear that in mind, I think that the main barriers are culture, resource, and time, genuinely. And I think the culture thing, I think research across the world has largely been driven by, we value things like prestige a lot too much. I think in careers we value headlines. We're always looking for breakthroughs, and if you think about what gets published in the top 3 medical journals, it's often a headline maker. But often the things that create headlines are either slightly oversold, or maybe harder to find when you do rigorous research, or you really control for everything. And so I think there's a sort of understandable psychology to this, but I think as an entire research community we've become conditioned to chase prestige, gongs. I mean, academia, gongs are really powerful, recognition, and sometimes that means we can just take the eye off the ball of process, and I think process is really important. We make very clear in the framework and the white paper that you can't do all this for nothing, that it's going to take time and it's going to take resource, and that's something that the early career researchers amongst just can't be held responsible for. So we need to create, senior researchers in the field need to work to create opportunities to make this stuff easier. That said, I mean, just coming back to the point about how this is harder for early career researchers, and there are things that drive us away from doing these things, I think you can actually use a lot of this stuff as a virtue and as a marker of quality and as a pathway to promotion if it becomes something that you're happy to signpost and communicate. So there's that terrible term on the right called virtue signaling. Well, I'm of the view that if we're doing virtuous things that we think are worth sharing with the world, then we should be prepared to signal those. So if you've got methodological rigor, if you've taken great steps to make sure that the community that you're working with and the community that gets involved in your research represents that broader community, if you've involved patients all the way through the process, if you've done that openly, I mean, I wouldn't be shy about that. That is all value added, and you should be communicating that value. And to me, you can build a reputation as an outstanding researcher by doing and signposting these things. So I don't think it's all downside at all. And of course, the other sort of background benefit to that is you can sleep well knowing that you're doing research in the spirit of trustworthiness that is actually more likely to benefit the community and create knowledge that we can all trust. So that's a kind of idealistic view, but I think that time and resource are required. And that's one of the reasons why, if you look at how we've organized a framework, researchers are just one piece of that puzzle. But there's things to do to get funders, to get institutions, to get publishers on board with this agenda. And we're already seeing change. I mean, since ENTRUST started, the Journal of Pain have appointed 3 transparency and openness editors just to look at and work towards that. Before we started ENTRUST, on the back of some of the work of the Action PR group, they were already really, Journal of Pain, again, making big changes in terms of equity, diversity and inclusivity. We're seeing those changes, and where one journal goes, then other journals can follow. Once these things become requirements, it's going to be easier that they're built in, and therefore potentially, hopefully, easier for researchers to do. And the other good example of this is the National Institute of Health Research, who have long required PPIE, this year have now required that within all grant applications there is a plan for maximizing ED&I within research. I mean, so there are great examples of how the levers of power can make it easier for people to change as well.
Yeah, and I think it's a great point, and we keep shifting to the different core values, which are very, very clear in the framework, which is really useful. But towards patient and public engagement, we've seen the shift of its importance over the last, I want to say X amount of years. I'm new to research, but you guys will know how long it's taken to have a shift from PPI not really being considered and hardly involved in research to what it is now. And I can see how this framework could run in a sort of same lineage in terms of its importance and helping people shape the trustworthiness in their research. And, kind of sticking with PPI, thank you so much for your questions, guys. Andrew, I'd love to throw it to you. And Marianne, thank you so much for your question. It says, what role does or should patient and public involvement and engagement play in developing trustworthy pain science?
Thanks, Nathan. Actually, I'm going to try and answer briefly because Anna and Neil will also have important perspectives on this. I'm not sure we talk about engagement anymore. It's partnership. We've moved on from simple engagement, and it's partnership right from the inception of the project. So finding out what's important and what we should be studying. So one thing, and that is gaining a lot of traction in clinical research, but it still has a long way to go in engaging in preclinical research. And we actually had some very interesting discussions around this when we were putting the framework together, where it's equally important. It'll be different how their lived experience experts partner with us, but it's equally important. So, for example, they will have a role in selecting the right things to measure and selecting what are the important questions. And I'm not always sure that research priorities are set at the preclinical level, having engaged lived experience partners. So it's equally important, but different. And it's one area where the concept is very new. Actually, ISP are currently revising our guidelines on the use of laboratory animals in research, for example. That'll report in about 18 months. We haven't done it for 42 years, by the way. And one of the very live topics in that is PPIE. But I think what I simply want to emphasize is partnership, not engagement. I think they're different. Neil and Anna will have different perspectives.
Yeah, go ahead, Neil. Share your insight.
Well, I was probably going to hand to Anna first on this because I've spoken quite a bit, but I'm happy to say something after.
Yeah, I'm happy to add. Yeah, I completely agree with what Andrew said. I think one of the things that sort of across the research spectrum, as he said, in preclinical, we have people, maybe I'm wrong, feel untrained. This isn't a training they've received and they're unsure how to include people. So sometimes it's not I don't think they should be included. It's I just don't know how to do it. I don't know how to do it well. I don't know how to do it as a partnership. And we still have that in clinical work, but I think we're moving more towards where this is becoming more integrated in our work, that we're receiving that training. And so those are things that I talk to actually my students about, is that it actually doesn't need to be huge at the beginning, especially if you're a PhD student, or if you're a PGR or an early career on this call. You don't need to start with like this huge advisory panel that maybe has many people, because as Neil mentioned, right, resources are a huge factor. If you can have that, if you're involved in a large scale grant that has that, fantastic. Get as many voices as you can and make sure they're coming from the communities that are experiencing pain. But having one or two people at the beginning of your career and learning how to work and build those relationships and where to have those conversations, and when those touch points, sort of when you're putting together ethics, when you're analyzing the data, when there's challenges of when you have to step back a little and actually listen to the person, that it is an actual partnership. It's not a consultation. It's not them coming in and signing off and ticking off on the work that you're doing, and learning that early. And so, we talked about early career a moment ago. I think those pieces can be integrated, and that doesn't require a huge amount of funds. People need to be compensated, but oftentimes, in addition to compensating monetarily, I find that especially the children and young people I work with, they were like, can I get like a certificate to say I was part of this research, or is that something I can put on my CV? So there's things that you can do that both benefit the individual, providing money for their time, but providing that they now are a partnership and they're involved in this. So I would say for early careers on the call, really think about that. This doesn't have to be something that starts out enormous, because you might have an advisor or mentor or your supervisor who hasn't done this before, right? Because that wasn't part of their training, and so you might have to build that in and start that slowly to be able to do that well across the spectrum. And so in answer to the question, I think it's vital that we include the patient and public, because oftentimes I would say that whenever I talk to individuals who are have lived experience of pain, one of the first things that they tell me, sadly still, is that they have an experience where they weren't believed about their pain. Right. And I think many of us have had that experience as well, or they've been invalidated about their pain. And until you start having those conversations, you won't structure and think about your research questions, keeping that at the core. So having those conversations is key as we move forwards. And also, you're just not, you're taking, sometimes a very small amount of money, maybe a large amount of resources, your career, and maybe working through an idea that seems wonderful, but if you haven't talked to the individuals who are experiencing pain, if you get to the end, it may not work for those individuals in your particular local communities or globally, because you haven't had those conversations. So from the very start, it doesn't have to be an enormous undertaking. You can do this smaller, but I agree with Andrew, it needs to be a partnership from the very beginning.
Fantastic, thank you. And Neil, anything to add to that one?
I'd reinforce that point about there's a need for training and support for people to do this stuff. I was thinking about this ahead of this workshop. We have endorsement from EFIC and IASP. that's potentially a powerful educational platform that can reach an awful lot of people. Maybe we need a trust camp or something, or we embed this into curricula in some way. And I think when I look across the framework, I think the areas in which, you know, it would be great to create some resources beyond what we've already done to try and support that would be in PPIE. I mean, there are a lot of tools out there, but some actual training around PPIE, around the ED&I piece, how to embed that through, and also around the how do you do open science part as well. A lot of people are very keen to do open science, but not that many people are that on top of the tech and how you present your data in a fair way and all of those things. We've been doing a bit of that already through the IAS Messi SIG. We've had some webinars on different elements of trust to try and give people some working examples. So we had one recently on equity, diversity and inclusivity, at which Anna spoke, as well as two other great speakers, where we had examples of different ways in which ED&I are being implemented in pain research. And we're going to have one coming forward on how to do open and transparent research as well. So not just you should be doing it, but how do you do it? The other thing I just want to throw in here, and this, we put this in the discussion, is it's very easy to sound a bit preachy when we're talking about this stuff, but the whole network are in agreement that we're not preaching from some position of purity here. We are all members of the community that we've written this thing and created this thing for. And we're all at different parts of our journey on different elements of the core values. But what we all agree is that these things are important and there are ways to make things different. So we're all on the journey. So this isn't about judging the community. It's about looking as a community and saying, what can we do better, essentially.
Mm-hmm. And I think that's might be where it resonates with a lot of people as well. We all recognize that this is an issue, and we all want to be in a better position to be creating trustworthy research. And I think this framework does a really good job at breaking it down into those sort of core components. And just kind of throw it back briefly before we move on, with regards to patient and public involvement and obviously partnerships. Marianne makes a good point there about, does this translate into patient co-authors, which I think is becoming more and more common, and also actively patients or people with lived experience being more actively present at conferences, which I think is a big move as well. So bringing those people in and collaborating with them from the start, obviously with their valuable insights. Moving on to one of my other thoughts was this is how can clinicians or researchers use this to assess the trustworthiness of research? And we have an anonymous attendee who says, does this framework also come with a tool that we can use to assess and verify if a certain study complies with elements of this framework, essentially saying, is this framework trustworthy? Is there a tool that is how can we do that? Andrew, I'll throw it to you. How can we use this?
I've got one point, but I think I'll pass over to Anna or Neil first, and then I've got one specific point I'd like to make.
Can I just touch on the tool question? So not exactly, but almost. So I showed you on the slide a really nice infographic of people's roles along the life cycle of a research project and how those values might be enacted. You could use that as a kind of audit tool. You could have a look at a paper and say, well, you know, what elements of this can I see were and weren't done? The other thing in one of our fact sheets is a fact sheet for peer reviewers. So it's specifically for all of us who are invited by, you know, journals all the time to make a judgment on research. But I think we have to be a little bit careful about asking a binary question. Is this research trustworthy or not? At the very bad end of research misconduct, I could show you some papers that are definitely not trustworthy. But then there is research that sits on a continuum and there is a judgment to be made. I mean, just as risk of bias assessment is sometimes a bit of a judgment, there is a judgment to be made about how well or badly a paper may do against a framework that we've only just published, by the way. So let's not be judging the entire history of research against standards that we're setting now. But also, you know, it isn't so binary as to be yes or no. It will be specific to the question. It'll be specific to the paper. And there'll be a judgment to make by the reviewer of that paper about how important each of these things, or the omission of some of these things, is to the value of the information that the research produces. So yes, we've got some things that people can use, but I caution against this kind of binary approach to this, where we're trying to judge papers as trustworthy or not, because I don't think that's really the goal of the framework, if that makes sense. But then I'll stop.
Yeah, I think it'd be a challenge to have sort of a stamp of Entrust or not, just because, as Neil showed, right, there's so many pieces that go into the framework, and not only that, so many levels and systems that go into it. So I think as reviewers, you can definitely, you could use the framework. I would envision it more from at the journal editor with, at the journal level with editors, and at the reviewer level, looking to see, how holistically this, study aligns with ENTRUST-PE and our framework. But yeah, I would caution against sort of a stamp, because I would worry that, a study that has many of the aspects but might not have something else, or vice versa, would then still might receive a stamp. I don't think we're quite there yet, but I would like to see it be enacted across our journals, to be quite honest, in terms of thinking about how do we look at papers. And so so one of the things that Neil mentioned as part of Action PR was our idea guidelines, which are sort of embedded in the Journal of Pain. So there are now questions when you review a paper for the Journal of Pain. Have individuals looked at these different aspects? And I've been involved in doing this in some psychology journals and pediatric psychology journals as well. And it's essentially these recommendations, and that gives the reviewer some latitude. So there's questions you must answer, but it also gives some latitude to be able to see for individuals to then improve the study as well, right? In terms of there may be things that they haven't included as well. So I think I would lean on that side of us providing a framework that can guide reviewers and editors, and for those who, as they're writing their paper, to think about each aspect, just like when you're sort of looking at your PRISMA checklist in a similar way, right? You're thinking about how these things might go into making sure that this is reporting everything that it should for a clinical trial, for example, but less on sort of a stamp of approval.
Thank you, Anna. I've got a couple of points on this. I think one of the things I tend to try and teach is that you should read the methods of a paper before you read the abstracts, and I'm not sure whether we all do that, but and then if you look at some of the very high profile basic science journals, the methods are in small print, often even as a supplemental file, which I think sends totally the wrong messages. But this is a topic of how to quickly assess whether something is worth reading that we've been thinking about. And a colleague of mine, Shai Silberberg, who's at the NIH, who I've been collaborating with on these topics in the basic science arena for many years, him and his team have come up with some icons that you can put on a poster, looking at many of the areas of rigor. I think there's 5 of them altogether. And we are going to probably try them at the next World Congress of Pain, or give people the option, but they rely on people's not just honesty, but understanding of the concepts. And actually, I think understanding rather than honesty is an important point. But before I just want to, so I put those icons up in the chat, and people can explore them if they wish. I want to cycle back to the PPIE or partnership issue, and there's one. The more you look into this, the more complex it becomes. And one of the things we're really struggling with at IASP, and we hope we'll find a solution, is that all of us as academics, or those of us on the call who are academics, we usually enjoy some kind of salary to participate in these activities. Often our lived experience partners don't. And should we really expect them to do this kind of stuff for free, particularly as we're asking for more and more work and more engagement? And certainly, I would like to see funders prioritize funding for the partners in a much more constructive way. But also, someone raised the importance about attendance at conferences. Well, we're all trying to keep the conference registration fees down, but encouraging our lived experience experts. We can't expect them to come for free or even to subsidize their own attendance. And the more you look into it, the more knotty a problem is. I'm putting it up as a problem rather than a solution because I don't know what the solution is yet. But maybe cycling back to Doug Altman, that other paper you quoted, Neil, we need less research and better research. So better research to me would mean proper funding for our lived experience partners. And that was one of the most powerful things Doug actually said. I think less research, but better research. Yeah.
Yeah, really, really powerful, and really kind of brings it all together as to why this is really important. Anna, if you want to jump in there.
I just want to add to what Andrew said, actually, because yes, our funders need to be able to do that. I think it's, I can only speak from my experience. So the NIHR here in the UK, I was able to put in a lot of PPIE funding. There is a specific, you have to have a PPI lead, and there is additional funding to be specifically dedicated to that. And so for anybody who's thinking about asking for that money, ask for the money you need if when you're applying for those grants at the early career stage as well. But the thought about the conferences, the other thing I think about conferences is actually having programming for individuals who with lived experience of pain at the conferences as well. So we're invited, even if we can get over the thorny issues that Andrew mentioned about having them there, getting them funded to be there, then only having them, perhaps, present for maybe 15 minutes with, somebody, an academic, I don't think is utilizing both their time and the partnership in the way that I think we might do. So I also think we have to think about that as well. How do we incorporate that programming? And I attend one conference where we have sort of this across the 3 days, there's a PPIE group who meet and have their own meetings, and then at the end they give us feedback on what is in the conference, what they would like to see differently, and I think those types of integration into our pain conferences I would like to see as well.
Yeah, and it really reiterates that meaningful involvement, not just having people with lived experience there almost as a tick box that their representation is there. It's actual meaningful and embedding them into what we're doing in research. Thank you so much for such a fruitful conversation. It has shifted kind of more towards the certain core values, but of course we'd need probably a good few hours to go through everything that's in this framework. So if anybody hasn't seen the framework, please use the links that are in the chat. And Andrew, you kind of mentioned the overarching comment there about less research but better research in a more broad aspect. I'm just trying to keep in mind that we have a few minutes left. I'd love to try and round up kind of on that point about, exactly, it's less about reporting guidelines, I guess, from the ENTRUST group in terms of this should be involved, this shouldn't be involved, and it's more about using it to inform your assessment of research or whether it's trustworthy or not. Could you give us a bit of an insight, if you give us a bit of an insight into if there's any other outputs that we might be able to see, or obviously you've kind of summarized everything that's out at the minute, what's there for the future for this project, and how do you see it being integrated into what we do every day? A little roundup would be a great way to kind of round off this brilliant webinar, I think.
Thanks, Nathan. I mean, we as I say, we launched a website and all the materials in December. You will see it's online ahead of print already, but in the March edition of Journal of Pain, we have a call to action paper which summarizes a lot of what we've talked about today. That's fully open access, so people can download that now and read that. The website, I'm hoping, will continue to live, and we'll keep updating it with resources for each of the core values as they come. And I want it just to be somewhere that people can go when they are planning research and wanted to think about, well, hang on, I know that there are these things I need to be doing. Is there any support or guidance on how I can do that? And we haven't created all that guidance, but we've curated an awful lot of great resource that is already out there that other groups have created, and it's in one place for people. In terms of what happens next, well, we don't have rolling funding for ENTRUST. So it was a 1-year network project. The network are all very on board and enthusiastic that the ENTRUST framework has value and that we're going to continue to promote it. And this year, I'm going to keep myself quite busy, I think, just pushing the message out there. I think there are things that we can think about in terms of other training offers that we could develop. Are there more tools that we could potentially develop? But we do need money for that. Otherwise, it becomes an academic hobby project, and the sustainability of those is quite difficult. I mean, I would love it if every lab downloaded our infographic of the lifestyle of the life cycle of a research paper, laminated it and put it up on the wall, because I just think it says almost everything in one image there. The other side of it in terms of the future is we're very keen on taking feedback from people. What haven't we done well, particularly? What could we do differently? What would be useful in order to help people go from recognizing these things to actually making change about those things? So my inbox is open. My email was on the presentation, but do please drop me a line if anyone has any thoughts about that. I'd love it to be a kind of community of practice on how we drive trust, rather than just our network and the members of our network that have created the framework sort of preaching.
Fantastic, great stuff, and thank you for all of you for attending today's panel and obviously sharing that super interesting information. So thank you so much for everyone for contributing to the session. We've posted some links to the resources for the ENTRUST-PE framework in the chat, so have a quick look if you want to grab those links before we finish. You can of course rewatch this webinar by accessing the Ethic Education Academy and also the YouTube channel if you want to watch it at a later date. And don't forget to share this online as well, so we can of course share this really useful information for everybody inside the Ethic and outside the Ethic network as well. So huge thank you so much to our panelists, Neil, Andrew, Anna. Thank you so much for your time today. Really appreciate it. And yeah, everybody have a fantastic rest of your day, and thank you for joining us.
Thank you.
Thanks, Nathan.
Thank you.